The urgent message from city leaders in Milwaukee, Wisconsin: COVID-19 is no joke, so take it seriously. Stay at home.
We have to take this serious. Those of you who are treating it like a game, treating it with conspiracy theories, it doesn't matter about you trying to think it's this or that. The reality is people are getting infected with this virus. People are dying from this virus. So we need you to take this serious.
Right now, more than 1,100 cases in Wisconsin. 13 people have died. Health officials in Milwaukee say the city's African-American community is being hit especially hard. Governor Tony Evers calling it, quote, a crisis within a crisis. One Milwaukee resident now recovering from the virus is State Representative David Bowen. He joins me now. Representative, thank you so much for being here to share your experience. As the public service announcement notes, there are people out there who think this is overhyped. This is not so bad. You, more than anybody, can help people understand that is not the case. Tell me your story.
Yeah, thank you so much for having me on, John. And essentially, this virus is much more easier to get than people think. And I had a chance to see a colleague who was elected on the local level. I saw him in cafe, and clearly he did not know he had the virus. I did not know he had the virus. And just like that, I was contracted the virus. By several days after that, I experienced some very intense symptoms that really resemble the common cold, but they really do intensify. And I was wondering why I was experiencing symptoms that were so strong. And I got a call from the health department that I was exposed to somebody that was exposed to COVID-19. And everything made sense at that point. It made sense for me to go seek medical attention from my primary health care physician, which a lot of people in my community don't have. A lot of people don't have access to health care, and it is blowing up this problem.
Well, let me jump in on that point there. Number one, the contact tracing worked. You had symptoms, but at least when your colleague was tested, that's so-called contact tracing, they found you and said, you may have a problem too. But take me inside. It's an underserved, underinsured, or uninsured community. When you see the disproportionate numbers, not just in Milwaukee, around the country, disproportionate numbers, African Americans, Latinos at the moment, what can be done? We're in this now. So what do you think needs to be done to raise awareness and to help tweak anything when it comes to healthcare disparity?
Absolutely. Essentially, you're seeing a majority African American among population on the north side of the city right now that accumulates for a vast majority of the cases that we're seeing, a big chunk of the cases that we're seeing statewide. And essentially, we need to get resources to families. We need to get, especially for folks that are continuing to feel the economic brunt and problems of the economy right now, trying to provide for their families. They're risking their lives, they're risking their well-being, their livelihoods to try to provide for their families, and we need to get those resources on the ground to those families. We have to cut through the misinformation. There's a lot of misinformation that was shared, especially when you have folks from the top down spreading misinformation to folks in the public. It allowed folks to not take this as seriously as they should.
And have we turned a corner in your experience from people you're talking to, friends you're talking to, not just people involved in politics, but people in the street? Do you get a sense, even the President of the United States now says the country shut down for the month of April. Is it sinking in finally among those who were reluctant to acknowledge the severity?
Well, I think it's almost there. The problem is right now is that people are still trying to find help to help pay their rent, pay their mortgage, a number of different things. They don't know, they don't have the certainty that those things will be taken care of or that they'll be given the leniency to take care of those things. And I think at the same time, you have a lot of people in our community. It has been all African American people that have passed away in Milwaukee County from COVID-19. And essentially, we have to still get the information out there of how easy it is to contract this virus, to spread it, to get people the medical attention that they need, that we know that we're cutting through years of disparities, equity that needs to be used to really get folks access to the help that they need. And right now, we are so far behind.
Well, I hope your experience helps us catch up, and I hope in a few months to see you at a Democratic convention and meet you in your town if that happens. That's one of the things we'll keep on the aspirational. Representative David Bowen, thank you so much. Thank you so much.